A stroke occurs when the blood supply to part of the brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. Brain cells begin to die in minutes. A stroke can result from a blocked artery, ischemic stroke, or the leaking or bursting of a blood vessel, hemorrhagic stroke. Some people may experience only a temporary disruption, known as a transient ischemic attack, TIA, that doesn't cause permanent damage. Epidemiology and cost of treatment in U.S. dollars of stroke for the society. Strokes are a major health issue worldwide, being a leading cause of death and long-term disability. The economic impact is substantial due to the costs of treatment and lost productivity. In the United States, stroke incidence is predicted to increase significantly, with a 34% rise expected in the coming decades. The costs associated with stroke care vary widely, but can be extremely high, with average costs per person ranging from $610 to $220,122.45, depending on the country and the complexity of care required. In the U.S., the total costs of stroke are projected to rise from $26 billion in 2015 to $75 billion by 2035. This increase is driven by an aging population, improved survival rates, and rising healthcare costs. Types of strokes in order of frequency and impact on society. Ischemic stroke. The most common type, accounting for about 87% of all strokes. It occurs when a blood clot blocks or narrows an artery leading to the brain. A. There are two main ways an ischemic stroke happens. One mechanism is endothelial cell dysfunction, which is when something irritates or inflames the slippery inner lining of the artery, the tunica intima. One classic irritant is the toxin found in tobacco. B. Another mechanism for ischemic stroke formation is embolism. Blood clot breaks off from one location, travels through the blood, and gets lodged in an artery downstream. Number 2. Hemorrhagic stroke. Less common but more deadly, this occurs when a blood vessel in the brain bursts, leading to bleeding, hemorrhage. Number 3. Transient ischemic attack, TIA. Often called a mini-stroke, a TIA is a temporary period of symptoms similar to those of a stroke. A TIA doesn't cause permanent damage but indicates a high risk of a full-blown stroke in the future. What are the early symptoms of stroke? Most specific symptoms are summarized in the mnemonic: fast, face, drooping on one side, inability to smile, or eye drooping. Arms, weakness or numbness, difficulty in raising one's arms. Speech, slurred or garbled speech, difficulty in understanding speech. Time. If these symptoms are observed, it is critical to call emergency services immediately. Less specific symptoms include sudden severe headache with no known cause, feeling of fatigue or fainting, general confusion or altered mental state. What happens in the hospital for diagnostic and therapy? A. In the hospital, rapid assessment using a CT scan or MRI is typically conducted to determine the type of stroke and its location. In addition, using a special sequence, FLAIR in MRIs, it's possible to distinguish a new stroke injury from an old one. D. Treatment may initially involve clot-busting drugs, thrombolytics, e.g. tenecteplase, for ischemic strokes, followed by removing the clot using catheter. E. Using catheters alone to fish out the thrombus, where thrombolytics are contraindicated, in other words, where their use can drastically increase the risk of bleeding. F. Surgery and other procedures to stop bleeding and reduce pressure in the brain for hemorrhagic strokes. G. Occasionally, surgery may be necessary to help clean arteries obstructed by severe atherosclerosis. For example, in a carotid endarterectomy, the internal carotid artery is opened up and atherosclerotic plaque is removed. Alternatively, a stent might be placed to keep the artery opened up. H. Rehabilitation begins as soon as possible to help the individual regain strength and recover as much function as possible. 7. How relatives can help in these trying times. Relatives can play a vital role by providing emotional support and practical help. They can assist with communication with healthcare providers, help in understanding and managing treatment and rehabilitation processes, and offer encouragement throughout the recovery journey. Being patient and understanding the emotional and physical strain that stroke recovery can entail is also crucial. If you found this video helpful, please give it a thumbs up and consider subscribing to my channel. Don't forget to hit the notification bell to stay updated with my latest uploads.